Hello everybody, my name is Lorna Frost and I'm an Environmental Health Officer and I have been for 29 years. I've been asked to speak to you and do this short video just to share my experience of taking part in the Public Health Practitioner registration scheme, and I became a registered practitioner just this year, about June time I think. First of all, I saw the scheme advertised on Bradford Council's website. I haven't done any formal qualifications or training or anything like that since I qualified 29 years ago, and I felt it was time that I pushed myself a little bit and got my brain working. I went to see what the scheme entailed and I felt yes, I could do this. It seemed quite straightforward. 3 commentaries, how hard can that be? However, the further I got into it at those initial stages, all the competencies that you have to comply with or prove, they all got fuddled up in my head and I found myself finding it very difficult. However, I did sit a long time before I put pen to paper, thinking, writing down notes, constantly, oh, that's a public health outcome. And so when I did start writing, it did flow a lot better. People have different styles. I found that my style is very much a narrative, telling a story of a particular job or jobs that I'd been involved with. I would say don't put an hour a night aside for this, put a big chunk of time aside each time you're going to do it, because it does take you a while to get your head into the competencies and then to be able to reflect on them. One of the reasons that I think I found it hard is I've never really had to do any self-reflection before, and that's what a lot of this is, telling the assessor what you've done and reflect on the success or the failure of it, what improvements could be made and how you felt it delivered public health outcomes. The benefits to me of doing the course are that it certainly made me value my job, my qualification, the work that I do, and also I'd never really sat down before and thought about the actual improvements I was making to some people's lives. My assessor said to me at one point, you really are delivering public health outcomes at the front line. And that was a real compliment to me, and I'd never really thought too much about that before. What I would say is I didn't do this to get a promotion. I didn't even do it to do a different job. I love my job, and I think it was good for me to show that an environmental health officer is always also a public health practitioner, and I'm very proud of that. And I think some of my colleagues would agree that somewhere along the line we were public health officers and then we became environmental health officers, and it's nice to tie it all back together again. What's next for me? Now I've got the qualification, and I think it's really good that we're doing it and that it's been rolled out throughout the north of England, and I would encourage other people to do it so it can be widely recognised. I've been approached to train as an assessor or a mentor, and I am going to try and do that because I would like to give something back, and I'll also be very interested to read other public health practitioners' commentaries on the work that they do. Good luck everybody.